I'm Tammy Johnson. I'm here to do the Female Peri Care for you that's described in your skill book. I'm going to do it step by step, pretty slow, so that you can see everything that I do. Here is on your table is bed protector, gloves, soap, a basin. We have a washcloth to wash with and one to rinse with, a bath blanket, and a towel. So that's the skills that you equipment that you would need if you were practicing this at home. So I'm going to start, and I will add a few things along the way. Knock on the door, and I'm going to identify. You can't just come up and say, "Hi, Mr. Jones." Miss Jones. You've got to look and see, "Hi, Miss Lee. I'm Miss Tammy." That's identifying and greeting. I'm going to be doing female peri care on you. You just have to hold your hands up and say hand hygiene, because you've already showed her hand washing in another video. And then pull the privacy curtain. Also gonna just add one little thing. If your call light is in place, and it should be, I like you to put it under the pillow, and that way it stays safe and you know where it is at the end of the skill. The next step, which is critical, and if you're following in your skill book, you will know that because it has the asterisk next to it. I'm gonna raise the rails. That means every rail. Now, if you're taking this in Madisonville Community College, this is very similar to the bed that you'll be using. Now, all the side rails are up. If the bed is moving up or if the bed is moving down, all the side rails should be up. If you're just raising the head of the bed, or if you're just raising the feet, you don't have to. But if the entire bed is moving up, or if the entire bed's moving down, you raise the rails. And then you have to decide what's a good working level for you. Shouldn't see you bending over, and I shouldn't see you tippy-toeing. Then I'm gonna lower both the rails, and I'm going to get my bath blanket, and I'm going to take it off the overbed table, and I'm gonna lay it on the resident, and I'm going to start unfolding. I shouldn't see you shaking it, because that spreads lint particles, which can cause pneumonia in the elderly, and then the bacteria that's on the bed and on the linen, you will be breathing in. So just take your time and just kind of get it unfolded. Be sure that you unfold the bath blanket completely, because if you don't, it's not going to be covering the whole back side of the resident. So I'm going to either hold this, or you can tuck it, either way you want, to pull the sheet down. Now pull it down kind of slow and straight, and for this particular skill you only need to go past the peri area. You don't have to go down past the feet. Okay? And then I go ahead and pull the gown, kind of get my area. Now this is going to be kind of hard to see on this video, but there's another video that you can watch for a close-up. And now I'm going to get my gloves on. Just remember, and I say this a lot in my videos, that you don't touch rails with gloves. Pretty much shouldn't see you touching anything but linen with gloves. Okay, so now I'm going to, now in your skill book it's talking about bending their knees and spreading their legs. These mannequins won't do that, and the elderly have a hard time doing that too. So I'm okay if you want to just verbalize that, just say that you did it. So I'm just going to say that I would help them if they can. So I'm going to kind of make this area, and then this is called a bed protector. It could look like this, it could be green, it could be cloth, just all kinds of different ones. Whichever one is laying on the bed is the one you'll use. So I'm going to have it folded and prepared the way that I'm going to need it. And this is clean and the bed's clean. Clean can touch clean, but clean cannot touch dirt. Now the proper way to turn your resident, because we turn residents or patients, we flip hamburgers. Please remember that. We turn residents and we flip hamburgers. Don't say that you're going to flip your patient, okay? Where you, palms up, under the shoulder, under the hip. I'm bending my knees a little bit, and I'm going to kind of roll her over here, and I'm gonna pull that bottom shoulder out, which steadies her, and then I'll lay my bed protector down, and then I'm gonna shoulder and hip and lay her down again. Get everything situated here. I'm gonna pull this back a little bit so maybe you can see, but again, there is a close-up video on this. Just in case you have not watched some of the videos with the mitt, you're gonna hold and secure it with your thumb, wrap it around, up, and there you have your mitt. I'm going to put it in the water, squeeze it out, soak, and because I'm on this side of the bed, I'm gonna make it on this hand, because you will need the opposite hand to say separate the labia. Be sure that you know your medical terms. That's the labia. We've got to separate it to clean inside the folds. It is not Liberia. That's a country. It's not Libra. That's a horoscope sign. It's labia, okay? So separate the labia. You have to keep it separated the whole time you're cleaning. I have soap, and I'm gonna wipe down, and this is a little dramatic. I'm gonna come out here, I'm gonna turn the washcloth, and I'm gonna wipe down, and I'm going to just keep wiping till I say it's clean. I'm gonna put the washcloth back here, and I'm gonna get my rinse washcloth. I like my students to say washcloth and basin and not bucket and rag. Sounds a little bit more professional. Separating the labia again, wiping down, turning that to another part of the washcloth, and I'm gonna rinse till clean, and then I'm gonna take my towel and I'm gonna pat dry. I'm then going to, and this is, believe it or not, this is one of the most common mistakes I see students make when they're testing in the skill room, is that they just do the front and forget to do the back. I'm not for sure why that happens. Maybe you're nervous and want to hurry up and get it over with, but it is a critical step that you do have to do the back side. So just like I did a while ago, shoulder and hip, turn, keeping them covered, pulling that bottom one, shoulder out there, and then you can expose the buttocks. And I know you can't see exactly what I'm doing, but again, it's on another video. Washcloth, make the mitt, squeeze the excess out, soap, and I'm gonna wipe from front to back, or vagina to the anus. I would say both, probably. Turning that washcloth with each wipe. Please be sure that you come out and turn that and not wipe back and forth. Then I'm going to rinse with a different washcloth. And I'm going to rinse from the vagina to the anus. And I'm just gonna go ahead and say, rinse till clean, pat dry with a towel. Now, in any of these skills, and this is almost 100%, that you take a towel out or you take a bed protector out, that is when you take your gloves off. So I'm gonna remove the bed protector. It will go in the trash. At state, you'll probably just hand it to her possibly. And now the gloves go off. This is the correct way to do your gloves. Should look like this. Into the trash can, and then be sure that you lift this bath blanket up when you lay her down, because if you lay her down with the bath blanket underneath of her, it's going to be really hard to get off. Then I'm going to pull the sheet up. I don't have very far to go because I didn't pull it too far down. Now, any of the linens that you take off, you want to roll them down, and you want to roll them away from you. And that's the proper way to take any of the linen off. And then that will go in your linen cart. And again, she'll probably just take it from you. Straighten this up a little bit. We want to raise the rails up. Those rails over there are already up. I'm going to lower the bed. and it needs to go all the way down, so just take it to where it stops. Rails are going down because those are critical steps. When you finish any skills that involve rails or raising the rails or lower the rails, at the very end, I want you to be sure that you turn around and that you look at your bed and make sure, take that one last look. Is my bed down? Is my rails down? That's on any skill, even if you're just leaving the room, like bedpan and partial bed bath. When you leave the room, these rails should be down. There is an exception on that, and that is the full bed bath, where you do leave the rails up to go get water, but that is the only one. Back around here, just because I'm going to make it look good. My colite was easy to get because it was under my pillow. And as always, almost every skill ends with colite, hand hygiene,